Hello and welcome to my channel. We'll continue our talk about the pelvis now that we have studied the individual bones and the articulations. We'll study the pelvis as a unit, by itself. The pelvis is a basin, as you can see here. All this is a basin and divided by the promontory into a greater pelvis as the one you see here and the lesser pelvis or the true pelvis with complete walls, the lower one as you can see here. Okay, so the line of separation between both is the pelvic brim. It's formed by the sacral promontory, which is the upper border of S1, the sacroiliac joint, the arcuate line, through the iliopectineal line, and then the pubic crest, okay, to the other side. This is the pelvic brim, and above it is the great or false pelvis that has no anterior walls, and below it is the lesser or true pelvis that's surrounded by walls all over the complete, and it's the one with clinical importance to obstetricians and gynecologists. Now, the superior aperture of the true pelvis is occupied by viscera, while the inferior aperture is by the pelvic diaphragm, pelvic floor, and a viscera, the external genitalia and the anal canal. This is the arrangement of the pelvic structures. The inlet, as I told you before, it's through the promontory to the sacroiliac joint, the iliopectineal or the arcuate line, iliopectineal line, and the pubic crest to the other side. To measure it for the importance, its clinical importance in obstetrics, the obstetrician wants to know if there's going to be an easy engagement. Engagement means the descent of the head of the baby or the fetus into the pelvis through, of course, the pelvic brim. So they use some measures or diameters. Like the anteroposterior diameter, it's called the sagittal diameter, sagittal inlet, or the true conjugate between the sacral promontory and the upper border of the symphysis pubis. This is the anteroposterior or the sagittal diameter. The diagonal conjugate, the sagittal one, anteroposterior, we called true conjugate. The diagonal conjugate between the promontory and the inferior border of the symphysis pubis. This is measured by the old name PV per vaginum, or the new name, the digital vaginal examination. And the fingers of the examiner shouldn't reach the sacral promontory, or it will be a case of contracted pelvis. If the patient from the same race, not, for example, the Southeastern Asians, which has small pelvises but small fetuses as well. So the diagonal conjugate is measured by the digital vaginal examination. The transverse diameter is the largest distance or maximum distance between points on opposing sides of the pelvic brim, the transverse diameter. The oblique diameter is between these one sacroiliac joint at one side and the iliopubic eminence at the other side. This is the oblique diameter. Okay, all these measures, all these diameters are higher in value than in females than in males. Okay, higher in value in females than in males. Okay, the pelvic outlet or the inferior aperture of the pelvis, formed by the coccyx, the sacrotuberous ligament, extending from the sides of the sacrum and coccyx to the ischial tuberosity, and the ischial tuberosities, the ischiopubic ramus or the conjoined ramus, and the inferior border of the symphysis pubis to the other side. And these are the boundaries of the outlet, pelvic outlet or inferior aperture of the pelvis. Also, some measurements of clinical importance in obstetrics. Like, for example, the anteroposterior diameter, the one extending between the tip of the coccyx to the inferior border of the symphysis pubis. We have the transverse diameter between 2 points on the ischial tuberosities. The bispinous diameter, very important because it's the narrowest diameter. It's between the two ischial spines. This is a diameter that worries obstetrician about the progress of labor. The bispinous diameter, distance between the two ischial spines. The oblique diameter between the middle of a sacrotuberous ligament at one side and the ischiopubic junction at the other side. Ischiopubic junction between the ischial ramus and the inferior pubic ramus in the middle, and the middle of the sacrotuberous ligament on the other side, which extends in this direction. This is the oblique diameter of the inferior aperture of the pelvis or the pelvic outlet. So in both, in the superior and inferior apertures, we have almost the same diameters, but the points are different between the pelvic brim and the pelvic outlet. The pelvic cavity itself, it's larger posterior than anterior. Anterior behind the pubic bones, posterior in front of the sacrum. It has a median curve, okay, and formed by the sacrum, the sacrospinous ligament. This is important in multiple choice questions. Sacrospinous ligament, because it's more ventral than the sacrotuberous, the one behind it. Sacrospinous ligament is part of the wall. The pubic rami and the ischial rami and the coccyx at the back, the sacrum and coccyx at the back. These are the boundaries of the pelvic cavity. It contains the rectum and the urinary bladder, or the rectum, the uterus, and the urinary bladder at the front. This is the organization of organs in the pelvic cavity. Okay, so this is about the pelvic cavity. Now, in this cavity, the plane of greatest pelvic dimension lies between the brim and the mid-level. Mid-level is around the level of the ischial spines. It lies between them, opposite the disc between S2 and 3 and the back of the pubis. This is the plane of greatest pelvic dimension. The narrowest, however, the plane of least pelvic dimensions is the mid-level. Which is at the level of the ischial spines, and I told you before that the bispinous diameter is the narrowest of all diameters. So pay attention to this, please. You will be asked about the plane of greatest pelvic dimension and the least pelvic dimension. Forms or morphological classification of pelvises between the android, which is a heart-shaped brim, the one in most of men, gynecoid, the one in most of women, which has a circular brim or even oval, slightly oval brim because of the wider pelvis. There are exaggerated pelvises from those, like the anthropoid, for example, which has a transverse equals to its anteroposterior. It's a complete circle. And the platypeloid, which is much, large transverse diameter. It's rare, and it's called the platypeloid pelvis. So the most common, of course, in men are the androids. and in women are the gynecoid. Okay, the position of the pelvis, the axis and inclination of the pelvis, it's put in position that while the person is standing, of course, the pelvic inlet makes 50 to 60 degrees with the horizon, while the pelvic outlet makes around 15 degrees with the horizon. At the same position, you will find out the anterior portion of the symphysis pubis is in line with the anterior superior iliac spine. Okay, this is the normal inclination and axis of the pelvis. Remember this. This is around 50 to 60, the outlet around 15 degrees with the horizon. Now we're done with the articulated pelvis. Let's talk about the fascia, and then the next lecture we'll be talking about the muscles of the pelvic walls. The fascia is parietal fascia, which is confined only around muscles, for example, or covering structures, not all over the bone, I mean. And the visceral fascia around the viscera. We'll be talking about the parietal fascia. There's the obturator internus fascia. This is a left sagittal. This is a sagittal section, and we are looking at the left pelvis from the inside. This is the obturator internus muscle on its way back, covering the obturator foramen with its membrane. Okay, there's fascia on it. It's called the obturator internus fascia. This fascia thickens in the middle to form an arch, tendinous arch, or called the white line, for the attachment of the levator ani muscle. You got the picture? For the attachment of the levator ani going to the midline to meet the other levator ani around the viscera. This is called the white line. Now below the white line, the fascia also condenses, but it's not shown here. In some sections it may be shown, to form an arch or a tunnel around the internal pudendal vessels and pudendal nerve, called the Alcock's canal, in the lateral wall of the ischiorectal or ischioanal fossa. Because the fascia below the white line, this is the lateral boundary or lateral wall of the ischiorectal or ischioanal fossa, to be more precise. It also, the fascia forms or arches below the obturator vessels and nerves. See that on its way, on their way to the in their canal, in the obturator, the defect in the obturator membrane. The fascia of the obturator internus arches below these structures to allow for their passage. There is a good deal to say about the fascia of the obturator internus. Remember that it arches below the obturator vessels and nerve, forms the white line for the attachment of the levator ani. Below that, it's the lateral wall of the ischioanal canal or ischiorectal fossa, and forms the Alcock's canal, pudendal canal. And above that, it's part of the lateral pelvic wall. Okay, so this is about the obturator internus fascia. The piriformis fascia, see, this is the piriformis on its way to the outside, to the gluteal region, where it will pass through the greater sciatic foramen, the piriformis. It's covered by its own fascia to the bare areas of bone around the muscles. I'm talking about the sacrum, of course, because the piriformis takes from the second, third, and fourth sacral pieces, so the fascia around them. Now, the nerves of the sacral plexus, when coming out of the anterior sacral foramina, they will find themselves behind the fascia. So the piriformis fascia covers the nerves of the lumbosacral plexus, while the vessels are at front of the piriformis fascia. So that's why the vessels, when they intend to exit the pelvis, they they have to pierce the piriformis fascia and take a sleeve of this fascia around them on their course outside the pelvis. So remember this: the nerves are behind the piriformis fascia. You will be asked this. You will face some multiple choice questions about this, and the vessels in front of the piriformis fascia. This is about the piriformis fascia. Now we are left up with the fascia of the pelvic diaphragm. The pelvic diaphragm is the levator ani muscle. It constitutes of an anterior iliococcygeus, a pubococcygeus, and a posterior iliococcygeus. And the most posterior is the coccygeus, or the ischiococcygeus, which has no function in man. So the levator ani, the one that ascends and descends, only is the ilio and pubococcygeus. We will be studying this. These are coronal sections of the pelvis, male pelvis. This is the prostate, the urinary bladder, the prostatic urethra. See, this is the membranous urethra after exiting the prostate, and surrounded by the what's so-called the urogenital diaphragm, the sphincter urethrae, plus the deep transverse perineal muscles. Okay, this is a more posterior section here, just to show you the superior and inferior fascia of pelvic diaphragm. See, this is the superior fascia of pelvic diaphragm, extends to back of pubis at the front, and blends laterally with the obturator internus fascia, and forms the pubovesical and puboprostatic ligaments. I'll show you the puboprostatic ligaments. See the superior fascia of the pelvic diaphragm. The inferior fascia of pelvic diaphragm lines the medial wall of the ischioanal fossa or ischiorectal fossa, as you can see here. This is another diaphragm called the urogenital diaphragm. We'll not be talking about this now. But this is the pelvic diaphragm I'm talking about, which is the levator ani muscle. See how it attaches laterally to the white line on the obturator internus fascia. See how the obturator internus fascia forms the Alcock's canal in its lower part in the lateral wall of the ischiorectal fossa. Okay, that's what I'm talking about when describing the superior fascia and the inferior fascia of pelvic diaphragm and the obturator internus fascia. Okay, this is I brought you these plates of real specimens just to show you the puboprostatic ligaments. See, this is the symphysis pubis. This is the prostate. This is the open urinary bladder. This is a sagittal section. As you can see here, this is the puboprostatic ligament. See, condensation of the superior fascia of the pelvic diaphragm. Here it is, the puboprostatic ligament. It's called pubovesical in females. No prostate in females, so it's called the pubovesical. You can see it here. Okay, so this concludes our talk about the articulated pelvis, the pelvic cavity, and pelvic fascia. Next time we'll be talking about the muscles of the pelvic walls. I hope you got the maximum benefit from this lecture, and thank you very much for watching.